The scare around monkeypox is only growing. In the latest, the United States has now declared the monkeypox outbreak as a public health emergency. They have over 7,000 cases, though luckily there has been no fatality because of monkeypox so far. Back home, India has reported 9 cases till date, and the central government has come out with new guidelines to contain its spread. In the US, vaccinations have also begun, and there is a lot of concerns that they may not have enough vaccines. So far, there isn't much known about monkeypox. The understanding has been that it doesn't spread very quickly. It is restricted largely to men who have sexual relations with other men, but all of that is changing in terms of understanding. The WHO has now clarified that women can also be very susceptible. To understand more on this and why we're seeing the spread in the US, is it a precursor to what we could see in India? I'm joined now by Dr. Rajiv Dang, HOD Medicine Senior Director and Medical Director at Max Hospital. Thank you so much, Dr. Rajiv, for speaking with us today on the India Development Debate. Let me begin by just understanding this big spurt in the US and their declaration of monkeypox as a public health emergency. Does it make the disease much more serious, and do we need to take it more seriously than we are so far?
See, it is always said that prevention is the best step. So when we know that the disease might spread, taking the best precautionary steps are the most important. Will it turn ugly is a difficult story, and it's a difficult answer. See, because the mortality rate is stated to be anything around 10 to 11%, but so far the morbidity has been only around 3% in the cases which have been brought out in different parts of the world. In India, there are only 9 cases so far, and we should expect some kind of deterioration only in people who have some low immune status for one reason or the other. In a normal person, it may not become really a difficult disease, but all said and done, as always, taking full precautions to help yourself is the first step toward the spread and care from the disease.
No, so I just want to understand, because the US has started vaccinating. We are not even talking about the vaccine so far. We're talking about ICMR. We're talking about ICMR, putting out tenders for the vaccine. I just trying to understand whether we need to vaccinate. Do you need to vaccinate against this disease?
See, the theoretical knowledge so far is there is no vaccine available in India, and whatever antiviral drugs are also being talked about, they are not easily available. I don't think we are at a stage of starting vaccination in India, or the need is there, because the very first step we need to follow and understand more. Vaccine will come a little later. There is no vaccine available as per now.
No, yeah, that's true. Let's just talk a bit about how it spreads. So far, the understanding was, it's a disease that spreads with close skin-to-skin contact. Most of the victims of this disease are men. Is that understanding changing to know whether it's a more broad-based kind of threat?
See, at this point of time, the literature says that the disease is seen in good number of, homosexuals and gays. It is also seen more in those who are handling animals. So, zoonotic being the basic kind of the disease, so it is spreading from Africa to other areas, probably because of more of international travel. Since the person-to-person transmission happens through macro particles of droplets, and it is a prolonged contact from person to person. So I think that kind of spread of the disease is still not taken its shape.
How is it happening in the US then? What are we missing here? Because 7,000 cases suddenly. And they're very, very concerned. Different states are declaring a public health emergency. Clearly, if this is the basic way the disease spreads, then, there is something that we're missing in terms of how safe we are.
See, when the COVID came in our part of the country, we started following some basic norms. So if those norms are being recommended by WHO for monkeypox, everybody is supposed to follow those. If I don't follow the basic norms of prevention of the disease, it has to spread.
Okay.
So we have to follow what is being conveyed to us by the media on the preventive stuffs, which is certainly through the qualified people of the medical fraternity. And those should be followed by the public at large. And that's what is going to help us first of all.
All right. Thank you so much, Doctor, for joining us on the show today as we track what's happening with monkeypox.
Thank you. Thank you very much.